You are listening to the Ebony Covering Black America Podcast Network, presented by Walmart.
This is Holly Cotton. Thanks for listening to Beyond the Fit. The purpose of this show is to cover a variety of health and wellness topics to make sure that you become the strongest version of yourself inside and out. The goal for today's show is that after this episode, you walk away feeling comfortable talking about topics that you may not have felt before, or you walk away with a little bit more knowledge about things that are going on with you that other people have experienced as well. That topic today is actually going to be about sexual health. We will cover some of the issues that males have as well as females have going through life. And it doesn't matter what age bracket you're in, sexual health is very important. And for some reason, we don't feel comfortable talking about these kinds of topics. So the first thing that I want to say is that there's this stigma with getting old. One, there's a stigma with 40s plus being old. And a lot of times I forget that I am 40s also. So when people are talking about things that are for 40-year-olds, I'm like, that's very interesting that you guys think that because that ain't me. So some of the topics that we will discuss today may be applicable to you. They may not. So just pick and choose anything that you actually can resonate with, or anything that maybe you were questioning or anything that you were worried about. And again, we're going to cover a couple of male sexual health issues as well as female sexual health issues. And I'm really excited because I have a show that is going to be coming up for both. I'm going to have a male physician and a female physician to cover actual medical diagnoses for males and females. So be on the lookout for those shows coming up in the future as well. So going into the topic of sexual health, the percentages of men and women who have reported that they have issues with sexual health is 31% of men said that they've had some kind of difficulty with sex. 43% of women have said that they have some kind of difficulty with sex. These are percentages based off of people that have actually said, yes, I'm having issues. These aren't the people who are having issues and maybe feel some type of reservation or embarrassment of discussing these topics. If you're like, what is sexual health? What does that even mean? Sexual health is a state of well-being sexually. It's whenever you are fully able to participate and enjoy sexual activity. A good sexual health doesn't just mean that you can have sex. It doesn't just mean that you are a sexual person. It doesn't mean that your body gets prepared to have sex. It actually means that you're able to participate and enjoy the act of sex. And a lot of times we have all of these stigmas that come up with not being able to perform or not being able to have an orgasm or not being able to have these issues. And I know as a nurse, I have treated and diagnosed several of these issues that men and women have. I have made sure that I have been open, had a platform for people to verbalize these issues, make sure that they feel comfortable enough to discuss these topics, because it is something that is taboo and not everyone feels comfortable talking to a stranger about it. Shoot, they don't even feel comfortable enough talking to their partner about it. So a lot of times people just act like these issues don't exist. First, I'm going to go into talking about some of the issues of sexual health that men face. And these issues actually can get amplified as we age. And this population of our listeners are middle-aged listeners. So take what you can from it. If it's something that you're like, that doesn't sound right, or you know what, I think I might have that. This is not in lieu of you reaching out to your primary care physician or urologist, gynecologist, whatever. Follow up with your medical professional. This show is just to highlight some of those issues and let you know that everyone is going through things, and these might be some things that you've been thinking are normal that are actually considered unhealthy for your sexual health. To have good sexual health, you need to have a combination of the physical and psychological factors. You have to be able to have a combination of interpersonal and social factors. It's not just the act of having intercourse. It comes with a whole other part. Are you being satisfied? Or are you enjoying enjoying it? Sometimes those are the key things that are missing. Like, yeah, you can perform, but are you performing at your peak? Are you enjoying it? Are you wanting to continue to do it? Whenever we're talking about the physical part of sexual health, we're talking about things like the desire, your libido, the ability to get and sustain an erection, erectile function, and on the opposite of that, erectile dysfunction. We've talked about mental health several times. There's several mental health issues that we've talked about that we face as we get older, from depression to stress to all these other things, anxiety, stressful lives, being overworked. Having a bad emotional state can also influence our physical state. And we've talked about that before, how having your mental health that's not in check can affect physical ailments or make you have physical issues. And this is one of those things where your mental health isn't right. Guess what? Your sexual health can suffer. So make sure you're dealing with any mental health issues for optimum sexual health. And you guys know, as a medical professional, I try and go read medical journals and do research and things like that. I don't just come on here and start yapping about topics that I have no idea about. And being a nurse for 20 plus years, I know that I have that medical background for it, but I still try to stay abreast, and I look up information and I go to all of these medical journals as well. For this actual topic, I did a lot of research with the Harvard scholarly articles and journals, and the number one physical ailment that men complain about is erectile dysfunction. And erectile dysfunction is classified by the inability to either get erect or the inability to sustain an erection long enough for satisfying sexual activity. So men can go from either or. Maybe they can get an erection, but they can't sustain it, or maybe they aren't able to actually hold an erection until they have an orgasm. So these are very common issues because it's the number one problem that men talk to their physicians about and that men report as far as a physical ailment. So if you have any issues dealing with that, it is a very common thing. That's why when you go to the gas station, there's all those pills that are sitting right there. Do you want a lottery ticket? Do you want an energy? And do you want an erection? There's like a whole section right there of pills and supplements for you to have. So obviously it is a common issue that a lot of men don't discuss. And men can be hesitant to discuss it because, one, it may be embarrassing. They may not be able to talk to their doctor about it. They may be ashamed because who wants to say that they didn't get an erection? Like it's something to do with the manliness. And sometimes men can feel hesitant to talk about it. And what happens is then that leads to stress because you're having this issue that you can't discuss and maybe you don't know how to fix, which then can lead to anxiety, and that can lead to your symptoms. So make sure that first time you're having any kind of physical ailment that you're talking to your physician about it. And like I said before, you have to have a combination of physical as well as psychological factors in order to have overall good sexual health. What are some other physical issues? Like, okay, well, I don't have erectile dysfunction, but I don't know, my sexual health is not that great. I can't have an erection for a sustained period of time, or vice versa. I have an erection for so long that I can't actually climax. So those are some physical factors as well. Some of those things that are underlying factors for those problems are maybe your testosterone levels are off. Low testosterone is something that's very common. And as you age, you actually lose about 1% of testosterone every single year as a man. And again, we'll actually have a medical professional topic coming up where we'll talk about testosterone and hormone therapy and things like that. But always make sure that you're following up with your physician. Are you getting that testosterone titer test every year? Like, or what's going on? You need to make sure that you're having screenings and things like that. Another big physical issue that most people don't even realize is having clogged arteries related to hypertension or high cholesterol is actually a huge factor when it comes to erectile dysfunction. dysfunction. And what happens is when you have anything that affects blood flow, you're going to have problems with your penis. That's just the bottom line. Like, there's no nice way to say it. That is it. When you have abdominal girth, as we've talked about before, pretty sure you have problems with your blood flow. You're having issues with cardiovascular disease. And what that means is that your normal diameter of your arteries and veins is actually clogged, so it starts narrowing. And the blood, where it used to just be able to whoosh, 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 flow through because you didn't have plaque and buildup, it's now taking longer for the blood to go through. Men, as you age, it may take longer for you to get an erection, or it may, again, that prolonged erection that lasts a very long time and you aren't able to climax. Look at your physical health state. Look at when's the last time you had a physical at your doctor's office? What is your blood pressure? What is your cholesterol level? Like, these tests are very important, not just because you want to make sure your heart is okay, but think about the importance of having good cardiovascular health. We're going to take a quick break and we'll be right back. Welcome back to Beyond the Fit. Some of the psychological factors that we deal with are stress in life, depression, relationship issues, and a lot of times with the relationship issues, say you're in a bad relationship, say you're in a bad marriage. A lot of times I know that I have people that have complained to me about that, men and women patients, and they have said that, like, hey, I would love to have a great sex life, but most of the time I can't stand my wife. Or I would love to have sex and I would love to have a healthy sex life, but my husband doesn't make me feel wanted, or I'm having these issues and blah, 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 whatever. So a lot of times those relationship issues you don't think of as a big deal, but they are actually affecting your mental sexual health status. So now we talked just generally about some of the topics that deal with your sexual health imbalance. I know, so now you're like, okay, well, hey, that sounds like me. So what you got? What's the recommendations? How am I going to be able to improve my performance? What do I need to do? One, you guys already know, as a certified fitness professional, I always bring it back to fitness. I just talked about the importance of having good cardiovascular health, good endurance. You have to get in better shape. You need more endurance equals better blood flow. It's very, very simple. That's why women will say that younger men have a higher sex drive. Maybe that is correct. I'm not saying that as we age men that your sex drive has to go down at all, because just like on the female topic, I talk about how it is important for you to have a good sex life until you're dead. Like, there's no reason when you get to a certain age why you cannot have a healthy sex life. But it comes with, when you're younger, you're in better shape. You, one, don't have all the stresses that we have as being these midlife working professionals and having these stressful jobs and careers and things like that. So look at those issues. Make sure your blood pressure is okay. Make sure you're getting your screenings and things like that. That's my number one recommendation if you're having any issues, or if you're just trying to improve your sexual health. One, get in shape. Start working on your fitness. Look at how you look. Look at those tests. Make sure that you're doing what you need to do. Cardiovascular exercise is defined as 30 minutes a day of sustained exercise. You pick whatever you want. Swimming, running, Stairmaster, treadmill, whatever. You want to make sure cardiovascular exercise is involved in your whole daily life routine at least 5 days a week. The second thing you can do, eat better. Stop eating fatty foods that create the plaque that we just talked about. Abdominal girth, get rid of it. Lose it. You shouldn't have a big old gut. The bigger your abdominal girth is, which I talked about in one of my first episodes, that abdominal girth is actually a ratio that they use for your risk of cardiovascular disease. So having a gut as you age, that's not a dad bod. That's an unhealthy bod. So you want to make sure that you're doing more and more things to stay in shape. And one of those is easy. Eat better. Stop eating fatty foods. Stop going to get the Tuesday special fried chicken. Get rid of the gut. Everything will work better if you are in better physical health. Now, let me also give you some tips, because there are specific foods that you can consume that actually increase your blood flow, which is what we're talking about, especially when you're talking about issues with erectile dysfunction, issues with erections, things like that. So some of the recommended foods to help with blood flow are: 1, onions and garlic, bananas, because they have potassium. Potassium actually lowers your blood pressure. Spicy foods like chilies and peppers, again, in their natural state. I'm not saying spicy foods like hot sauce with all of the sodium, or the Tony Chachere's or anything like that that has all the salt and everything. We're talking about chilies in their natural state. Even cayenne pepper is okay in a small, moderate amount, but you want to make sure that if you're adding spicy foods, that you're not doing these processed foods that have tons and tons of sodium in it as well. Make sure, know the differentiation. Eggs actually balance out the hormone levels. So again, testosterone issues, eggs can help. And also omega-3 fatty acid foods, salmon, tuna, avocados, olive oil, all those foods that they talk about with omega-3 fatty acids, those are very, very good for a healthy heart. The fourth way is reduce your stress level. I have talked numerous times to various people, as well as in my own segments, about stress and how stress affects your body. Stress slows everything down. So when you are in a stressful state, what happens is your heart rate goes up, which causes your blood pressure to go up. And when you're in that sustained state where you constantly have an elevated heart rate, that will keep your blood pressure elevated as well. It's not the heart rate raised. That's a good thing. Like when you're running or whatever, think about it. When you get a stressful phone call and you're at work, when something happens and you're stressed out about the kids, whatever it is, when there's a stressful state, your heart rate goes up. That's called that fight or flight reaction. And if you're living in stress, your body stays there. And what happens is it causes you to have an elevated blood pressure. So you need to make sure that you are implementing some of those key stress reducing strategies to lower your stress level. Another way to help with the physical aspects of male sexual health is stop the bad habits. Stop smoking. Stop drinking alcohol. Again, everything has to do with the blood flow. When you smoke, you narrow your blood vessels, which means less blood flow through smaller veins, which causes more dysfunction issues. So if you're smoking cigarettes, if you're smoking tobacco, I have bad news for you. You may think that just because you don't have cancer, there's tons and tons and tons of other negative side effects from smoking. Stop smoking. Alcohol lowers your metabolism. Alcohol has tons of bad things. That's why you have a gut, and that's why they call it a beer belly, because alcohol causes that abdominal fat. It increases your cortisol levels. It causes your metabolism to slow down, so you're not able to burn fat at rest. So if you're drinking, stop. There's tons of bad things that go with that as well. Again, in moderation. I'm not telling you how to live your life. I'm just giving my advice from a medical professional standpoint. And finally, always, always, always talk to your doctor. I am not giving you any advice. I'm not telling you what to do. I'm telling you, we're highlighting these topics because I want you to know when something isn't right. And I want you to know when you have something that's happening to you that could actually be a medical condition. It could be something that you need to start seeking out some type of professional help for, whether it be a mental issue or a physical issue. There's tons and tons of things that are going on that a physician can help give you advice about. I'm just talking about the problems that we face as we age, things that we're all dealing with, even if we aren't aging. Because in my head, I still think I'm 21, but my body is like, ma'am, you're not. You're midlife now. These changes as we age are normal. It's normal for your body to go through stuff, just like when you were younger and you went through puberty. It was perfectly normal for your body to go through it. It's perfectly normal for you to deal with these things now. The whole thing is to make sure that you are doing what you should do to make sure that you are functioning at your optimum health at whatever point you are in life. Your sex life is part of overall health and well-being, and you need to discuss treatment options. You need to discuss getting your test levels checked. And you also need to realize that some of these things, as they get identified and some of these issues that you're having, could actually expose some underlying conditions like blood clots, plaque, veins, high blood pressure. So I can't stress the importance of identifying issues and not just saying, oh, well, today I couldn't get an erection, or today I couldn't have an orgasm, or I was winded, or my erection lasted for an hour. Is that normal? These are ways for you to open the door to actually talk to your physician about some of the things. And we want to make sure that our male population and our male listeners are also going beyond the fit. We're going to take a quick break and we'll be right back. Welcome back to Beyond the Fit. One of the topics that I have a huge passion for, especially as a woman, and then as a fitness professional, and also as a healthcare professional, because I am a nurse and a nursing professor, I really have a passion for women's health issues. When we get older, there's different issues that we have for us, hormones and body functions and things like that as we age. One of the most common issues that women face, and this isn't even as we age, this is just women in general. So for anyone that has a uterus, this show is about topics that you can relate to. One of the big things that I hear about all the time, and I also dealt with myself, is endometriosis. And it's a very common condition. About 1 in 10 women are diagnosed with endometriosis. Several people don't even know that they have it. And one of the resources that I utilize for this show is from the American College of Obstetricians and Gynecologists, which is actually acog.org. So if you do not have a gynecologist, or you just have general questions and you don't want to bother your doctor about, that is a great resource for you. It is evidence-based practice. It's medical journal answers, things like that. You can definitely get whatever questions you have answered by utilizing that website. I did use it as a reference for some of the topics that we're going to talk about. I wanted to just basically provide first what the actual definition of endometriosis is. And that is a common condition where the tissue lining the uterus grows or is found on the outside of the uterus. So basically, the lining that you have inside of your uterus, for whatever reason, starts growing on the outside. And as you know from health class in high school, the lining of the uterus is what sheds every month, and that's what causes you to have a menstrual cycle. So when that's growing on the outside of the uterus, that's whenever you have endometriosis. And it's a very common condition. For whatever reason, there's actually an increase in the risk for African American women for endometriosis. A lot of times we're diagnosed with this starting around 30s to 40s. Again, this affects a whole population, anywhere from 30, even in their 20s. A lot of women now are being diagnosed because there's so many new advancing technologies and all of these new diagnostic tests. So women are actually being treated and diagnosed earlier in life as well. So what happens when that tissue grows on the outside of the uterus? Well, one, you actually can have bleeding of the lining of the uterus. So it can shed just like the inside of your uterus. And a lot of times around your menstrual cycles, you can get the same cramping, but it's amplified by this shedding. So if you are having super painful periods, if you're having any type of pain and pelvic pain, abdominal pain, definitely mention that to your doctor when you go for your annual visit, because it could be that you have endometriosis. If it's not treated, what happens is that constant irritation then causes scar tissue. And if you are having issues with infertility, if you had issues with infertility, this probably hits home for you, because that constant inflammation and scarring, what it does is it can grow and block the fallopian tube. As you are trying to have a baby, the eggs and the sperm can't go down the fallopian tube to the uterus, where you can actually, I'm not going to go through the whole process because you guys have seen Look Who's Talking, the movie with John Travolta, you know how the babies are formed, you've done health classes, but that endometrial tissue, that's endometriosis, what happens is that can cause scarring of the fallopian tube. Sometimes it completely obstructs the fallopian tube, so there's no passing, and sometimes it compresses it so it affects the sperm and the egg, either one of them, or a fertilized egg, and trying to get through the fallopian tube to the uterus. It's just a whole process. So if you're having infertility issues, if you're having any type of pain, especially around menstrual cycles and with sex, it's very uncomfortable. And a lot of women do complain that they are having extreme pain with sex, cramping, things like that, and it's very uncomfortable. 1 in 10 women are dealing with the same thing as you. Another common issue that I wanted to talk about, because this is really common, and women, for whatever reason, don't feel comfortable talking about their sex life. As women age, a lot of women start having a decrease in sexual desire. That's why there's memes about women getting older. That's why they make jokes about the aunties. That's why there's this stigma that older women don't have a sex drive anymore, and younger women are ready to go all the time and older women aren't. It's a whole process that's very, very common. Again, that acog.org website has tons and tons of information as well. What happens is, as we age, we start going through these different phases. One of the phases is called perimenopausal, and another phase is called menopause. You can actually go through the perimenopausal state for years, and that means that you are progressing to that menopause state. And menopause is when you actually have a cease of your menstrual cycle. So you can stay in perimenopausal for years, as maybe there's different things going on. Maybe your periods aren't as regular as they were. It could be different things that goes with being perimenopausal. But one of the key things to that is because it is our hormones that are being affected. So there's 2 hormones, well, really 3 hormones, but there's really the estrogen that's being affected as we age, and also the progesterone levels. And those 2 can have tons of effects on you. It can cause you to go through these perimenopausal states. Another reason why sex drive can decrease as you age is, one, we is tired, okay? Like this is the time period, 30s, 40s and above, where you are working, you have kids, either you have kids that aren't babies anymore, you have grown kids or growing kids. It's a lot that falls on us. We have to make sure they're doing their homework, they're passing school. We want to make sure that they're doing what they need to do in life. And it can be very stressful. And what happens is that we are fatigued. In addition to being parents and doing all of this, we are also usually career path women. We're trying to become bosses. Like, we have all of these different roles that we're doing. And sometimes those excessive roles and that stress can also cause us to be depressed. And I'm not going to go into that because we've talked about several mental health issues before in other shows, but depression is a key thing too that can affect a woman's sexual drive. And if you're depressed, if you're fatigued, if you're going through some stuff with your hormones, the last thing that you feel like doing is being sexual or even feeling like a sexual being, which is really, really, really common also, because when you don't feel sexy, it's hard for you to be engaging in sex. One of the things that you definitely need to do is talk to your partner or talk to your doctor. Sometimes we start taking medications for other things that happen in life. Your primary care doctor may have put you on a blood pressure medication or a diabetic medication or all these other, especially antidepressants. And a lot of those, one of the side effects always says decreased libido. Make sure that you are talking to your doctor about that and determining if there's alternative treatment, if there's alternative medication. Don't just look past that as a side effect. Most of the times people want to brush under the rug that side effect, but they'll tell their doctor, oh, well, I had a dry throat, or I had a little cough, or it's making me have jitters, but then you never bring up, and it made me lose my sex drive. Like, what is going on with this? Be verbal about your own health. It's okay. Embrace it. Also, on the other side, even if you don't have any of those underlying conditions, sometimes some of the issues are basically you just aren't aroused. You're not getting turned on. A lot of times women aren't orgasmic. They can't have an orgasm. And then again, another reason why you may feel that your sex drive has decreased is because of pain. We just talked about endometriosis. Who wants to have sex and every time you have sex, you're in extreme pain with cramping and all these other things? You don't feel sexy and you don't feel that desire. Again, also, when we're talking about hormones, a lot of times, whenever you start going through this perimenopausal or menopausal state, you can have vaginal dryness, which also affects how you want to be perceived with your sexual occurrences, how you feel sexy or not feel sexy, how you want to initiate sex or not initiate sex. So all of these things can make you, maybe you still have a drive, but because you have all these other issues that you're dealing with, it's just like, never mind, it's too much to deal with, so I'd rather not even do it. You can still have the drive, but all the other issues may be causing you to withdraw from feeling like a sexual being. Some of the recommendations that the ACOG gave is, one, increase your time for foreplay. We say that all the time. I've seen, if you follow me on social media, I've posted memes before about this topic, about how women and how we want more foreplay and how men are just ready to go and whatever. And I'm not saying all men, so if you're a man and you're listening to this, calm down. I'm just saying that women that are having sexual issues and things like that, a lot of times one of the major things that they voice, because me as a nurse, I've also dealt with women and I've heard them complain about these things, and it's because the vaginal dryness, because there's not enough time for foreplay. So if you have a partner, this is a time to say, hey, it's not that I don't want to have sex with you. I would love to have a great sex life. I just feel like we need to spend a little bit more time with foreplay. Also, women, we talk about Kegels all the time. Why? Because Kegels strengthen your pelvic muscles, which is what helps you with vaginal tightness. It helps you with all of the muscles because that is all muscle tissue. And the stronger your muscle is, the more you're going to be in tune with it. So make sure you are doing those Kegel exercises to keep those pelvic muscles tight and working and functioning where they need to be. An easy solution is what? Get you some sleep. Always make sure that you find time to focus on getting you some rest. Again, we just said, if I'm busy dealing with kids and life and jobs and all of this and deadlines and all these other things, then when it comes to that, sometimes we push that on the back burner. So make sure you're being well rested. Another recommendation that a lot of medical journals and experts say is that you need to work on common things like mental fantasies, implement toys, read some books. I just went to Walmart the other day and they have a whole giant section of all these romance books. And I'm like, oh, okay, this is interesting. There's a whole section. Hey, if you like to read, go get you a book, read it on your lunch break, read it in the car, when you're sitting at home in your driveway, get that mental fantasy going, get your mind into it. And that can also help you with either getting aroused or having an orgasm or increasing your sex drive. And then also a big issue that people always bring up, which we said generally, is the vaginal dryness. Make sure that you are finding something to help with that sensation, because you do start having a decline in the sensation and also lubrication. And even if you're 65 and 70 years old and you are menopausal, guess what? I went to Walmart and I saw a whole aisle of prophylactic and sexual enhancer stuff. Go in there, bring your partner in there. Let's try this. This has taste. This is hypoallergenic. Look at whatever they have there. There's tons of things for you to help you with this. I just wanted to cover those two topics in general because those are very, very common topics and they lead to such a big opening of various other sidebar topics and talking points, because endometriosis causes blah, blah, blah. Decrease in sexual desire causes blah, blah, blah. So there's tons of alternate talking points that come from those two topics. So I definitely wanted to just address those and kind of say that you're not alone. Like, these are common things that women are dealing with. And that's why it's so important for us as women and women that have a voice to speak on it. And it doesn't have to be raunchy and it doesn't have to be dirty or inappropriate. These are things that women, because we're taught that we're supposed to be a lady, and talking about sexual health and talking about vaginal issues is not something that we're supposed to do. And you do have a voice for it. So use your voice, be proactive, and you have a whole life together. I want you guys to have great, great, great sexual health until you're 104 years old. This isn't just 30, 40s. Now all of a sudden you can't do anything anymore. No. I'm just saying that these are the start of some of the issues. These are when a lot of women start identifying these things, and these are when people are getting diagnosed with these things. But it may be 60, 65 years old, and you may have been in menopause for 12, 15 years before you ever have any side effects of menopause. I just want you guys to have some information, and you can determine whenever something is coming up when it's important for you to talk to your physician or your partner and quit hiding it, because it is an important topic. In my book, Day One, I have these things called life checks in the middle of the chapters or at the end of the chapters to basically sum up what we've covered so far and reiterate any pertinent information and make sure that you are retaining the information so that you can use it however you need for your life. So I like to implement those into my show as well, because I want to make sure when we cover a lot of information that can be kind of technical like we did today, that you're able to use this life check as an opportunity to remember key things that we talked about and also to push you to be a healthier version of yourself. Today's life check is: men, erectile dysfunction is very common. If you feel like you're having any issues, you're not alone. It's a common thing. Look at your health. Look at your health status. Make sure you're following up with your physician. Make sure you're treating any type of diagnoses that you have to ensure that you are able to have a good sexual health level. Make sure you're reducing your stress. Stress, as we've covered numerous times in other shows, is a key factor to causing physical ailments. So if you are living in a stressful environment, if you are working in a stressful environment, you have to find ways to reduce your stress. Eat better. Make sure you are picking foods that actually fuel you. You have to change your diet, especially as we age and we have risk for multiple things just from being older, because our body starts breaking down and things start not working at the key performance level that they did before. So you need to make sure that you're eating proper foods that actually fuel you and your fitness level. Women, make sure you're not ignoring symptoms that can actually be medical. Make sure sure that you are letting your physician know whenever something isn't right. Remember, pain during sex is not normal. So if you're having any kind of discomfort, then this is the opportunity for you to talk to your physician, talk to your partner, make sure that you are intervening. Women's sexual health is just as important as men. It's important for you to feel comfortable exploring different techniques to maximize your experience. And for both men and women, anyone, having a partner you can talk to about whatever it is that you're feeling is important. Don't be afraid to bring up the topic. It isn't wrong to have needs, and it's not wrong to have those needs met no matter how old you are or where you are during your lifespan. You deserve to have optimum sexual health. Sexual health encompasses every single thing about your life: physical, mental, psychological, spiritual, all of those topics. So make sure that you're able to discuss those topics with your partner or someone anytime you're having reservations or anytime something doesn't feel right, because we want you to continue going beyond the fit.